Good morning. You are listening to Eagle Analytical's Coffee with Ross podcast with Eagle's very own president and CEO, Ross Caputo, Ph.D. Eagle Analytical recently launched a new product and service. You are offering service wipe sampling kits to validate cleaning protocols and testing to validate cross-contamination is not occurring. USP General Chapter 800 provides standards for safe handling of hazardous drugs to minimize the risk of exposure to healthcare personnel, patients, and the environment. USP 800 recommends wipe sampling. So the question is why 503A and 503Bs should focus on something that is recommended and not required.
Well, because it should be a requirement and it came out of recommendation because everybody complained. You should think about what 800 says. 800 says, in a nutshell, protect your employee from hazardous drugs that could make them sick and make them sick now and chronically throughout the rest of their life. And then put the part, if you want to. Makes absolutely no sense. So USP 100 is a handling of hazardous drugs, of drugs that can hurt, frankly, the worker, not the patients. It is primarily around patients. Now, in the GMP world, right, in the 503B versus 503A, we raise the price of poker. Okay, raising the price of poker means that in the 503B world, not only do you have to control the USP 800 to help the employees, there's other sections in there that say you cannot have cross-chemical contamination. And cross-chemical contamination to people who are allergic or sensitive or perhaps pregnant or have some other immunocompromised type of issue can be catastrophic. If you are allergic to penicillin and you get the smallest amount of penicillin that got maybe carried over in a capsule or carried over in a syringe or carried over in a drug, you can die. You can get anaphylaxis and die. This is no joke. They've known that forever. So that is the definition of really cross-chemical contamination. But that also comes into when you start talking about, you're supposed to clean all the time. Even if I have 3 drugs that aren't toxic, I probably don't want all 3 of them in my aspirin. I don't want all 3 of them in my antibiotic because who knows what happens, how it works. It just simply doesn't belong there. So throughout 800 and cross-chemical contamination and making sure that you control the environment from chemical compounds, it's not about biology, it's not about sterility, it's all about the control of chemical compounds, control of the drugs itself, right? So as you get through that, you come down to, well, gee, gosh, oh golly, cleaning is important. In the GMP world, in the 503B world, they have to have extensive cleaning validation protocols to prove that when they clean something, it's actually cleaned. Even if it's not hazardous. If it's hazardous, you're supposed to neutralize it. And then you're supposed to clean it. And then you're supposed to make sure that the next product that you come in that same bench, that same hood, that same area, that you don't in fact cross-contaminate it by accident. No one's meaning to do anything. But you'd be shocked to go see some of these hoods, some of these weighing stations that have powder all over the place. So the activity of making sure that things are clean is not like you're sweeping the floor. It's making sure that it's truly clean, that it's proven clean. The USP 800 and the activities within pharmacies indicate you should know it, you should clean it, and you should make sure it works. That sounds like you should do that, right? In the 503B world, you must do it, you must document it, you must show that it works. You must show that if you're using ABC agent, you must show that it works on the material. So we'll do cleaning validation studies on stainless steel, glass, plastic, with composite tabletops, the scales and the activities of the forceps and the spatulas and the mortar and pestle. And in fact, it's required that you test all of those items by putting a known concentration of compound on it, show that you can give it off, take it off. Actually, microorganisms as well, if you're doing disinfection, and get it off. And actually in hazardous drugs.
Let me guess, there's a recommendation to have 2 different dishwashers.
One for hazardous and one for non-hazardous. Because in that dishwasher, when's the last time you cleaned your dishwasher? It doesn't mean it's going to be perfect. There are nooks and crannies and things so that you have to do that as well. So at the end of the day, you have to be careful to go back to a concept of quality mindset. Know why you're doing it. Make sure that you don't think you did it, you know you did it. You know you did it right, and make sure you do it all the time, especially when no one's looking. That's really important. Some of the compounds that we do are very fine powders. So in the weigh stations and 503B, GMPs are a little bit different. They're much bigger operations with bigger controls, but in the compounding pharmacies and some 503Bs, they have some fine powders or liquids. And what happens with some liquids? They dry and you don't always see them. And what happens? You're there with fingers, you're there with pieces of stoppers perhaps, things that are touching that you can now cross-contaminate without knowing. It looked clean, isn't clean. It's maybe clean, but you don't know that, right? The job's not done till the documentation is finished. And this is why you have to use things like swabs that go in and actually test, did it work? So when you do a swab test, if you're doing a particular drug compound you use, you're going to want to actually put some drug on that surface, let it dry, then go back and clean it and see if your swab picks up anything. If it doesn't, good for you. It means whatever you did to clean or neutralize worked. If it does, maybe you need another 4 minutes of cleaning, of soak time. Maybe you need a different detergent. Because I have to tell you that I saw a person try to clean a sugar spill, dextrose, 70% dextrose, 50% dextrose, are things that they use for nutrition. You can't clean it with alcohol, all right? Because that's not soluble. You have to flush it with water first and go forward. Yet we see in pharmacies, I'm cleaning with my alcohol. Not really. You ever see oil and water? It doesn't work. Look at your salad dressing. That's why you have to test to know what's going on. Swab measurements of where we are, whether it's from cleaning a hazardous drug, a non-hazardous drug, or a microorganism, is an easy method to go in, very innocuous, test it, send it away. Sample and test, sample and test. And how often do you have to do it? How about when you start? How about when you know your procedures are right? And how often do you do that after that? I think every new guy coming in ought to get tested. Every new guy that comes in, we make sure that if they're in sterile, that they do media fill tests, they do fingertip tests, they do gowning tests, they do all of that stuff. But that's where we're going, and I think that mindset of quality goes on both sides of the equation to make sure that we are always thinking about what we're doing, and it has got to be cost effective. It has got to be cost effective. The data from last year of individuals, companies, that had received 483s required work with the agency and the pharmacy boards, with lawyers and attorneys and studies, because perceived cross-chemical contamination. It's our job to prove what we're doing is correct. It's not an investigator's job to prove that we're incorrect. The onus is on us.
Thank you for listening to Coffee with Ross podcast. Feel free to share your thoughts on this and other compounding related topics. Maybe your comment will be featured as a topic on an upcoming podcast. Until next time, remember to always have a quality mindset.